Hey everybody, it's Russ Curtis, professor of counseling. Thanks for joining me today. Thanks for all the people out there liking and subscribing to this boutique channel for open-minded healers. This is a great book. I highly recommend it. Any helpers out there should read this book. And I was a little bit hesitant at first. I'm not sure why, but I did. I have found. Oh, I probably have about 20 pages left, so there'll probably be another video once I get through the very end. Here's what I wanted to do because throughout the book, Patrick Gagne talks about how there's just not a lot of treatment options here for folks with sociopathy. And interestingly enough, reading the book and listening to some of her interviews she's given, I'm actually picking up on kind of treatment advice that she found helpful. And so I just wanted to summarize some of that because I do think we can actually work with this. And let's take a look at this. So, first of all, as all of the diagnoses should be, including the personality disorders, it should be on a continuum. And that's what she's essentially saying in this book, is that when she first started discovering she was a sociopath, she found nothing because the term was considered outdated. There was a lot of controversy about it. For instance, I believe in the DSM, it's considered secondary psychopathy. But really, from a continuum, you're looking at, we have neurotypical, which would be less severe symptoms. Sociopathy or secondary psychopathy would be a little bit more symptoms, and psychopathy would be the most severe. So I think in order to treat this well, we have to see it as a continuum. And sociopathy would be not as severe as psychopathy. It could be reframed. I got this directly from her from an interview instead of sociopathy because it's got so much stigma as low affect disorder. That these folks need more stimulation. There is some type of neural abnormality that doesn't allow them to feel as readily as other folks. Believe it or not, I've actually read, I don't know if there's studies about this, that people who are high on extroversion need more stimulus as well in order to not feel depressed. Anecdotally, I know of somebody that actually said that to me. It's like if they go for too long without interaction, they feel very depressed. So I think we can maybe normalize that a little bit more. Also, they're acting out in order to feel. Okay? And it's a compulsion much like OCD. Okay, so this is what Dr. Gagne is saying in her book. And so it's a tension that builds, and we need to find healthy pro-social ways to relieve that tension. So first of all, as a therapist, we want to normalize. This is 5% of the population. That's a lot of people. These folks are not evil or mentally ill. They can do really bad things. They can do violent acts, but they're not evil or mentally ill. It's neurodivergent. They have a brain abnormality most likely, and we may not have the tools or equipment to be able to figure out exactly where and how. We do know that this is the case with psychopathy, or at least there's strong evidence for it. I'm going to say this. So again, I'm getting this information from what she said in her book and interviews. This was early in the book, and it's something I've experienced in working with clients, is that I would say that maybe reduce the prolonged eye contact with folks, and especially if they're activated. That creates a tension with folks who are high in this sociopathy scale. So consider that, play with it. And we're always wanting to be ethical, good boundaries, and strong supervision as we're working with folks. I would want a supervisor that's got some dialectical behavior therapy training here because the emotion regulation skills can be helpful. Mindfulness. One thing that Patrick said is that recognizing that thoughts are just thoughts, that impulses are just impulses. She does not have to act on them. And just because she has them doesn't mean that she one day will. We'll talk about this more with cognitive restructuring. So mindfulness is a part of this. I would want to ask this from a solution-focused perspective if I was working with somebody, is tell me about times you resisted an impulse. Because what I want them to see is that they have the capability to resist the impulse. And in fact, they've actually been building that skill and that asking about what pro-social strategies help you resist while also relieving tension. because we don't want somebody just sitting in the tension, but clearly not to act on especially violent or criminal impulses. But helping them see is, hey, you're actually really successful at managing these impulses. Let's look at what you're doing at the times you've been successful versus the times that you've acted. As I mentioned before, dialectical behavior therapy would be good to understand some of these. They've got some great skills with acronyms that you can teach folks on just how to manage some of the anxiety that may be associated with the tension that you're experiencing. Again, I think this comes back up into helping folks recognize thoughts are just thoughts, impulses are just impulses. That's not who you are, nor do you have to act on these. One, cognitive restructuring, this I think I got is pretty much, not exactly word for word from Patrick in the book, is that she found helpful. Is the unhelpful thought is, because I have impulses, I will one day act on them. The helpful thought, the restructured thought, is there is no evidence that I will act on thoughts. In fact, I have plenty of evidence the times I did not act out. And I'm building my ability to let impulses go without acting. So practice makes progress. So some cognitive restructuring can be as well. Just to kind of summarize, first of all, understand the disorder and let's reframe it as low affect disorder. Let's help clients normalize. Pay attention to eye contact. I'm just kind of curious about that. It's just something I've experienced. We're going to have good boundaries ourselves using mindfulness, some solution-focused strategies, DBT strategies, and some CBT strategies. Okay, good people. There will be more videos on this. The book's really good. Highly recommend it. But let me know your thoughts, and we'll talk to you in the next video. Take good care.